After 15 years of being a massage therapist, I'd like to share with you the most important tool that you can use to boost your effectiveness with your clients, increase your standing as someone who they turn to, and thereby increase your business success. Recommendation number 1. When someone arrives for an hour session and complains of shoulder pain, work the area of complaint first. Don't do your normal routine and eventually get to the area of complaint. Go there first. Now I know that some people recommend working the opposite side to any injury before you get to that injury. So if someone's right shoulder is sore, work the left side first. Okay, so the idea is that by stimulating the nerves on the opposing side, it reflexively loosens the other side that has the injury. I think this is a fine way to work and shows that you're really conscious of how important the nervous system is in controlling muscle contraction. You may also argue that working the entire rest of the body first decreases the entire tone of the nervous system. So when you get to the injured part, it's already really relaxed. So these are all true physiological principles that are useful in thinking about healing and body work. If you work this way, you should also communicate this to your client. Tell them, I'm going to work on everything else, and then at the end of the session, get to your injury. So that's okay if that's what you do. But consider what my experience has been as a receiver. I tell them my shoulder is sore, the therapist writes it down, then gives me the same massage session I've received from them every other time. What's the use of a client intake or even talking to your client if you're just going to do the same thing on them? My other experience is that if the therapist doesn't start by addressing the area of complaint, I spend the whole session as the receiver wondering if they ever are going to get there. Did they even hear me? Lastly, it is entirely possible that you can run out of time. Some injuries can take a good 20 minutes to evaluate and address, and so if you don't start soon, you could run out of time by the end of the session. So please, if someone has a complaint, address it first, and if you're not going to address it first, then tell them why and when you're going to get to it. Okay, Mrs. Smith, before I work on your shoulder, I'm going to work on the back of your head to relax you because you just seem so uptight that we couldn't make any progress starting on your shoulder. Recommendation number 2. Test, you fool, test. Test and talk. Push, talk, test, 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 test. I've been talking about a shoulder injury. What does that mean? You need to get much more specific. There are 3 ways of doing this. In the intake, where does it hurt? Your shoulder, where? In the front? Okay, I'll work there. Oftentimes therapists will work the front of the shoulder, then after the session say something like, I hope that helps. In my experience getting body work, this is 90% of therapists. If it's you, The second way of working, and what I recommend, goes something like this. Your shoulder hurts. In the front? Okay. Then on the table, you apply pressure and speak the words, tell me what area is most sore, and start pushing like a maniac, or maybe not like a maniac, but more like a professional, conscious, skilled, and caring therapist. When you find the area that's most sore, then work on the area using whatever you do, effleurage, petrissage, and static pressure. Then move on to a new spot. After a minute, come back to the spot that was most tender and push and ask again to see if the tenderness has diminished from your work. If it has, you're doing good work, and you can decide if you should keep going on that spot or just move on. There are a few different camps to this. Some people recommend working on trigger points by static pressure for 8 seconds, then leaving the spot alone for a while, and then coming back with another 8-second burst. Doing that a few times. Or you can push longer, like 30 seconds, or do movement work, and never come back to the spot, or anything in between. I don't think there's really any right way. It's really your preference as a therapist, except that you must go back and reapply pressure at least once after you've done your work to see if it was effective. So you don't look like an idiot saying, I hope you feel better when they leave, but instead knowing that they do feel better because the spot that hurt the most now doesn't. Now, the reason the pain diminishes after applying pressure is because of the nervous system. The body doesn't like signals of soreness coming through the spinal cord, so chemicals called enkephalins are produced to block the pain signal. This means that the static pressure that your thumb applies actually numbs the area. The numbing process also cuts the motor nerve signal at the same time. This means that the spot goes numb and the muscle relaxes at the same time. So the client goes, "It's easing up," at the same time you're saying, "The muscle's softening." If you practice this way, you're in the top 10% of massage therapists, actually dialoguing with your client and hunting for those spots. There's also a third way of working, and this is what is so cool and what I want to show you. Ask your client where it hurts when they do some motion. Then apply pressure to the area after you've worked the area, have them do the motion again without your thumb pressure, and have them tell you what percent better it is. If it's 80% better, then that's good and that's what you want. If it's only 10 to 20% better, you're working on the wrong spot and need to keep searching for the true cause. I hope this talk about evaluation helps you become more conscious and specific in your massage practice. Good luck. In order to use your client's painful motion to guide your work, you'll have to know the action and location of all the muscles. Our DVD, Anatomy and Pathology for Body Workers, can give you this information. And our set Deep Tissue and Neuromuscular Therapy can show you specific tests for each area and how to use massage to help the most common injuries.